Good morning, good afternoon, good evening. My name is Javier Guzman. I'm the director of the Global Health Policy Program at the Center for Global Development. I am very pleased to welcome you today to this joint event organized by the Pan American Health Organization and CGD on pooled procurement and essential medicines. Specifically, we'll be answering the question, what can we learn from the PAHO Strategic Fund experience after a uniquely difficult year? We all know the pandemic has hit the Americas disproportionately hard, and it has not been easy to balance the emergency response with priority public health commitments and routine health services, including securing the supply of essential medicines and other health products. Pool procurement mechanisms such as the PAHO Strategic Fund created in 2000 provide a potential solution to these challenges. We know the fund aggregates demand, improves countries' negotiation power, ensures quality assured products, provides alternative financing, and strengthens procurement planning and supply management at the country level. Today, we'll hear about the advantages, barriers, challenges faced by the fund in this past year, and we'll reflect on the way forward. So a couple of housekeeping comments before we get started. First, viewers can submit questions during today's event via YouTube or Twitter with the hashtag CGD Talks, or could email us at events@cgdev.org. Also, this event is being broadcast in Spanish and English, so you should see an option for your preferred language on the event page. Without further ado, we welcome Jarbas Barbosa, Assistant Director at the Pan American Health Organization, for some introductory remarks. Welcome, Jarbas, over to you.
Thank you, Javier. It's a pleasure to meet you again virtually. Javier and I, we both were regulators during a period of time. Javier was leading INVIMA, and I was the direct president of Anvisa. So it's always a pleasure to meet you again. And I want to thank also CGD for this joint event that will be this very important reflection about what's the role of a pooled mechanism in order to support the countries to respond better to a public health emergency. The past year and a half has been enormously challenging for health systems around the world. The Americas was hit particularly hard by the COVID-19 pandemic, with over 70 million cases and almost 2 million deaths, as well as severe impacts to our economies. Coordination and distribution of essential medicines and supplies is paramount during public health emergencies. However, a combination of supply chain disruptions, rising healthcare costs, lack of financial support, and inadequate quality control made managing and delivering life-saving resources increasingly difficult. The emergency response required was unprecedented, and the note was reminding of the need to effectively control infectious disease outbreaks while maintaining routine and essential health services. While the pandemic has pushed our communities to their limits, the crisis has also highlighted examples of resilience in the face of extraordinary circumstances. Innovative strategies were deployed to ensure access to critical therapeutics and other health products. Health workers went above and beyond to respond on the front lines at the hospitals and clinics. Scientists developed groundbreaking vaccines and diagnostic tests. Perhaps most importantly, we saw firsthand that no nation is truly safe until health systems everywhere are strong and resilient. This has only made our pursuit to achieve universal health more urgent than ever before. Throughout the pandemic, the Pan American Health Organization has worked closely with member states and partners in the Americas to facilitate access to essential medicines and supplies through the PAHO Strategic Fund. Established in 2000, this program was developed as part of a comprehensive package of technical cooperation to improve access to quality-assured, safe, and effective medicines and supplies, and to strengthen the efficiency and sustainability of public health systems across the region. as the primary regional technical cooperation mechanism for the pooled procurement of therapeutics and public health products. The Strategic Fund contributes to countries' commitments in achieving the UN Sustainable Development Goals by addressing critical gaps in universal health. I'm pleased to launch the 2020 annual report of the PAHO Strategic Fund on the 20th anniversary of the mechanism to celebrate its progress across several priority areas, with growing needs for member states to maintain the availability of essential health services and technology amidst complex challenges such as COVID-19. The Strategic Fund has risen to meet increasing demands. In 2020, the Strategic Fund supported a threefold increase in purchases compared to 2019 and forged new partnerships with over 49 countries, territories, and health agencies participating in the mechanism. By the end of the year, the mechanism supported procurement of over $580 million worth of medicines and supplies since 2018. This provided for the prevention, diagnosis, and treatment of over 87 million people throughout Latin America and the Caribbean. In addition, as part of PAHO's Incident Management Support Team, the Strategic Fund supported national COVID-19 response and the shipment of diagnostic kits, PPEs, and critical care medicines, reaching over 31 million patients and health workers, while upholding our commitment to improve access to other health technologies required for COVID, for HIV/AIDS, tuberculosis, malaria, hypertension, and cancer. Last year's annual report highlighted the need for the PAHO Strategic Fund to address the increasing demands being placed on health systems. This year, the Strategic Fund has demonstrated what is possible when we work closely with member states in the spirit of solidarity and Pan-Americanism, and in the pursuit of health for all. PAHO looks forward to continue working with all our partners to support the country needs in the face of COVID-19 and an accelerated recovery of lost public health gains. To this end, we will intensify our efforts to ensure access to essential medicines and public health supplies through the Strategic Fund on behalf of our member states to support the delivery of essential health services for all. Thank you, and I wish that we can have a very good experience today during this webinar, sharing experience and learning how to improve the access for medicines and medical supplies in our region. Thank you.
Thank you very much, Jarbas. A pleasure to have you here, under our different roles. So now we're gonna welcome Alejandra Hidalgo. Alejandra is the Vice Minister of Insurance and Management of Unified Health Systems at the Ministry of Health in Bolivia. Bienvenida, Alejandra. La palabra es tuya.
Sí, buenas tardes.
Yes, and good afternoon. Can you hear me well? Can I be heard? Thank you. I would like to thank Bolivia's participation in this very important meeting for us, and to thank Jarbas Barbosa, Executive Director of PAHO, and all of the executive committee that is present in today's meeting. If you could help me share my screen, Julio, so I can show my slides. So as the Minister of Health, we are very glad to have been invited to participate here regarding a pool procurement for essential medicine and our experience with PAHO, which we have received technical assistance from them so that we can better address the pandemic. And as you can see here on the screen, Bolivia, within the 2020 efforts, we have done in average less than one test per 1,000 inhabitants. PCRs are very little available in our public system, And they're expensive in the private sector. We have had high costs, and this has impacted our Bolivian population. And now, since the beginning of our new president's efforts for 2021, we have been able to quadruple the number of tests available, reaching the data of 4 tests per 1,000 inhabitants. Now we're using intensive, using all of the antigenic tests in all of our health centers, in more than 4,000 of them. Also, in addition to this, we're using these tests and providing them free of cost. The positive rate is around 10% in the past 2 months, and we have been able to reach these numbers. In most of the countries near us, the positive rate is much higher, even though we have the same number of PCR tests. We're looking at 36% in Paraguay, 37% Argentina, and in Brazil, up to 63%. And within these, Peru is at 78% on this positive test results, highlighting that currently we are only at 10% of positive test results. Next slide, please. We have seen that Bolivia, in the year 2021, we have been able to reduce the fatality to less than 2%, 3 times less lethal than our efforts for last year in 2020. And as you can see here on your screen, during the first wave, you can see that the mortality was up to 7%, and we had peaks of up to 16%. Now, when you see 2021, this has decreased down to 2%. Next slide, please. We have also looked here at the singular evolution within the COVID-19 pandemic. In the first wave, the mortality rate lasted 264 days. In the second wave, 141 days. And we can see on the screen some of the data where we are making comparisons and trying to establish by region. In one of the regions where we're making some actions like Oruro from 6.2, we have decreased during the second wave down to 4.6, the mortality rate. Another one of our highlights is Santa Cruz from 9.8 to 1.9, based on all of the different activities that we've been carrying out, and we have been able to verify that we have been able to reduce significantly the mortality rate, like Cochabamba from 9.3 down to 2.5. So this starts to paint a picture of the work and efforts that have been carried out. Next slide, please. On screen, you can see Bolivia on the third position with the highest expense in terms of public health. Bolivia has already reached the 30% of the public budget invested at the first level, and we have carried out several actions in primary care health, mainly for the benefit through the SAFSI program, reaching out to 492 doctors and more than 2,700 teams of family health. And with this outreach for family health, and our efforts are based on monitoring, education, communication, early diagnostic, and massive diagnostic, since it's been free of cost, immediate isolation or quarantine that we have been doing, by household. So this has allowed that in each household, we are able to facilitate not only outpatient treatment, And this has enabled us to be able to treat those cases that truly required hospitalization. Those are the second or third level at the hospital. So we have been able to reduce the number of patients at the hospital, of hospitalizations. And here we can see we have received adequate funding for this. We can see here for the past 3 years. So based or thanks to the uh, single health system, we're able to provide healthcare services to everybody in our population. So we see here both the primary care as well as secondary and tertiary. And as you can see, the budget that is allocated has been a significant amount, and it is important to highlight because currently we have a guaranteed allocation for health and currently have more than $395 million assigned to be able to take care of all of our population within the SUS, the single healthcare system, which serves close to 7 million people. And the difference, those other 4 million receive or have some other type of health care insurance. That is then, and thanks to everything that is SUS, we have been able to prevent patients from being charged. And in this way, we have been able to reduce down to 75% the cost. And our goal is to continue to work in this area so that we can provide this basic health to all of our population that is receiving this type of healthcare benefit. And it is key to mention all of the support that we have been able to receive through WHO and through the Strategic Fund, PAHO Strategic Fund, because it is through this mechanism we have been able to, as a country, to receive medication, both for intensive care as well as for hospitalizations. And the methodology that we have been able to implement in primary health care, everything at the primary care, has been very useful for us because we have been able to do the active monitoring of all of the epidemiology cases, as well as the uh, introduction of new variants, being able to monitor them. So to be able to do this and be able to control the surgence of new variants, and in this way being able to provide immediate response in these cases. Also, through the strategic fund, we have been able to obtain and acquire equipment to be able to provide this kind of health care, including at the home. In other cases, patients that have had to go to the respiratory centers that we have established in several of our regions, of our departments. And in this way, we consider that this has been a very important participation uh, within all of that WHO and PAHO offers, so that we as a country are able to successfully handle the pandemic and be able to uh, have the results that I have shown you. Through the Vice Ministry of Health Care Insurance, we currently have outlaid more than we have millions of uh, citizens that have been able to acquire medicine supplies, including oxygen, and this allows us to be able to provide a better healthcare response, to be able to uh, take care of the next wave upcoming, which would be the fourth wave. So in that context, we, Bolivia, we also want to thank all of the actions that are carried out, as well as the technical assistance that we receive. And this has enabled us to be able to put together this type of strategy at all of the intervention levels, not just in primary health care, but also being able to implement actions at the second and tertiary level. And in this way, Bolivia has been able to ensure that the data that we have been compiling and presenting in the first, second, and third wave, these are positive results for us as agencies, because all of the experiences and things that we have been implementing through technical assistance has helped us to achieve these positive results. And currently, our country is scaling down in terms of the pandemic. And in the same way, we are working towards vaccinating 100% of our population over 18 years of age. And towards this, we're up to 96% of the vaccines have been guaranteed to arrive to our country. And we hope that in this next several months, we're able to receive these vaccines and vaccinate our population. We have received more than 4.5 million doses that we are administering already. We have also received 1 million doses through the COVAX mechanism. These are the Janssen vaccines, and these will be distributed soon across all of our country. So these are integrated strategies that we have implemented through all of this technical assistance and participation. On behalf of Bolivia, I would like to thank the assistance that we have received and the work that we have put together with all of the authorities, and as well as our TA counterparts from both WHO as well as PAHO. Thank you.
Thank you very much, Alejandra, for giving us the country perspective. I think it's interesting to see how the strategic fund was able to quickly, pivoted to procuring COVID-related supplies, including medicines for intensive care. Now we're gonna hear remarks from Prashant Yavad, Senior Fellow at the Center for Global Development. Over to you, Prashant.
Thank you, Javier. And I want to start by congratulating all of the colleagues from the Strategic Fund at PAHO for the work that you all have been doing in the last 2-3 decades in improving access to medicines. I have been an observer from the sidelines, clapping and cheering when you achieve outcomes. So overall, great work. Also, thank you to Minister Hidalgo for the work that they're doing in Bolivia and for outlining some of the recent work around COVID medicines and vaccines. I want to focus my next 5-6 minutes on highlighting 2 things. One is, what have we learned from the work of the Strategic Fund, which can be applied to other settings around the world? And second, where are opportunities for the Strategic Fund to do even further in improving access to medicines? And the 2 are connected and not necessarily separable, so please bear with me as I try to outline that. So the preface to all of this, when we talk about what can we learn from the PAHO Strategic Fund in terms of food procurement, has to start with a clear understanding and acceptance that food procurement is not a technical matter. It can start, and a key prerequisite for it is political solidarity amongst the countries, the member states, the purchasers who are coming together. In the absence of that, multiple attempts which have been tried by global, regional, other agencies to highlight the technical benefits of food procurement have had very small shelf lives. They have lasted for a few years and then thereafter have fizzled away. And there is a mixed bag of evidence on the value of food procurement without political solidarity amongst the member states. So that's the first preface that we have to accept and start with. Then I think we have to also separate the benefits that result from food procurement into 4 main buckets, in my opinion. The first bucket of benefits from food procurement arises from a better balancing of power in the purchasing selling channel. So in markets where the supply side is concentrated, where there are very few suppliers in the market, that's a situation where food procurement creates a better balancing of power And a better balancing of power is beneficial not only from the standpoint of price obtained, it is also beneficial from a number of other respects, such as delivery lead times, transparency, ability of the purchaser to understand the upstream supply chain of the seller or the supplier and so on. So multiple benefits may arise. But we also have to accept that not all health product markets have the degree of concentration amongst the suppliers where the benefits from pool procurement and the balancing of power necessarily are equal. In some markets, they are higher. In some markets, they are very limited, if any. And the strategic funds work has shown that there is heterogeneity. If you do it all together, then you balance out somewhere you can demonstrate large benefits, somewhere the benefits are small, but as a basket for the purchasing member states, net, they get a good benefit. If we try to segment the medicines market and say, for this small sub-segment, we will buy using pool procurement. For the remaining, we will buy independently. That creates a challenge where the benefits then have to come very visibly, very directly from the subset which is being used for pool procurement. So that's a question. Can we do it for a subset? Probably not. Should we do it for as extended a basket of medicines as we can? The answer is yes. Then is for medicines which are very low priced, the benefits of pool procurement are things which some country governments and procurement entities question. If it's really cheap, how much more will I benefit by putting this into pool procurement versus using my country's own procurement structure? And that's an evolving debate, and also goes back to what I said about the basket. The second category of benefits result from lower transaction costs. Every country trying to do its own tender, soliciting bids, evaluating them, making the delivery terms, the payment terms, and all of those things can be much lower when it is done as a pool. There, the benefits exist irrespective of the type of the product. Any medicine, any product, higher concentration of suppliers, lower concentration, the benefits of transaction cost savings are high across the board. And the transaction cost savings are not only for the purchasers, it means not only for the countries who are purchasing in the pool, but also for the sellers in the market. Even the pharmaceutical companies and suppliers benefit when there are reduced transaction costs. Sometimes we forget that, but I think it's an important part to keep in mind. The third benefit is when the pool procurement entity carries out not just procurement, but a set of adjacent activities bundled together with pool procurement. Whether it is about providing upfront financing, working capital, doing downstream delivery type of work, many other activities which are not core to procurement, but are adjacent to procurement. When you bundle that, that creates a benefit structure which is more sustainable in the long term and continues to create long-term value for both parties in the buy-sell relationship. Lots of examples there, and I think the strategic fund and the working capital structures attached and lots of things are clear demonstration of that. The final category are benefits which we have realized more importantly in the last few months, and they come from pool procurement becoming a vehicle for improving resilience in the supply chain. If you're an individual country, you cannot afford to split the volume of your total purchase in a year amongst 3 or 4 suppliers. You typically will go to one supplier because the volumes are small, and that means by design you have less resilience. If that supplier is located in a region, or that supplier goes through some other kind of supply disruption, then the entire supply gets disrupted. But if you are purchasing on behalf of multiple countries as a pool, your ability to split the tender between 3, 4, 5 suppliers and creating both supplier diversity and also geographical diversity becomes higher, and that becomes the strongest contributor to supply chain resilience. And we've seen some examples of that with the strategic fund. We would like to see with more clarity and more data how it pans out with the strategic fund, but I think that's an area worth thinking about. Then I think two last things I want to mention. One is, when we think about where should procurement be carried out, this is a question that many country governments outside of the Latin America region keep asking, and we work with many of them at CGD. Many of them were part of the group that CGD ran on procurement a couple of years ago. And their question is, should I buy nationally? Should I buy subnationally at the provincial, state level, district level? Should I buy as a part of a regional pool, or should I buy globally from some kind of global pool? And the answer is not always clear and simple. Because if the outcome metric is price, then yes, purchasing globally or regionally through a pool procurement is the best way. But if the outcome of interest also includes availability at the clinic level, then maybe the price negotiation function can be carried out nationally or regionally or globally, but the actual placement of purchase order and delivery could be carried out nationally or subnationally. And the duality of purchasing in Chile, for example, using both Chile Compra and Cenabast is one example of showing how multiplicity is a useful tool when price is not the only criteria. You're also looking at availability and guaranteeing that at the clinic. In summary, I feel lots of interesting things we've learned from the strategic fund, but we need to go to the next level, both at the strategic fund and also in new places where similar initiatives are started. The next level will mean that the boundary of intervention is not ending with a product handoff model where the pool procurement entity purchases and hands over the product to the country. Visibility into what happens after the product has left the factory gate of the supplier or has arrived the purchasing country's port, that visibility is important for planning, for forecasting, and for going into a better model of information sharing with the suppliers so that they keep their campaigns, their batches aligned with when a large purchaser such as the strategic fund places their order. They should be able to proactively say, this is when their order will come. I should reserve a space in my campaign planning for the order to be coming from either this country or this procurement pool. So that's the next level of engagement, which I think we ought to think about. Thank you. Back to you, Javier.
Prashant, thank you very much for taking us through the benefits and also the way forward. I think a lot of the elements you mentioned will be discussed now with the panelists, but I just wanted to recap, one critical point you mentioned, which is, the political solidarity as a prerequisite for this type of procurement pooling mechanisms. So now we're gonna go into our panel. We have 4 distinguished panelists. We're gonna take some of the elements outlined by Jarbas and also by Alejandra and Prashant. But before I do so, I just wanted to remind our audience that you can send your questions via YouTube or Twitter using the hashtag CGD Talks, or by emailing us at the email address events@cgdev.org. So the panel we have, I'm going to introduce our 4 panelists. So first, Socorro Gross Galeano. She is the PAHO country representative in Brazil. We also have Julio Garay, chief of the National Tuberculosis Program at the Ministry of Health in El Salvador, and Alia Porras, unit chief, medicines and health technology at the Pan American Health Organization, and Claudia Vaca, associate professor at the National University of Colombia. So we're gonna get started with a very general question, kind of like getting your views and your perspectives on what are the main procurement and supply chain barriers multilateral pool procurement mechanisms like the PAHO Strategic Fund are particularly well suited to address, and of course, everyone would speak about, their own experience, but it'd be great to get started with that key question. So Socorro, if you can share with us, your experience and your views on that question, please, over to you.
Yeah, just to understand the barriers, no?
Yes, the idea is to, talk a bit about, what are the key barriers that this mechanism is able to address, is able to solve. So what problems do you think the strategic fund has been able to solve in Brazil, has been able to solve in your experience?
Bueno, primero un saludo a todos los
First, a
participantes.
hello to all of the participants in this panel, especially to the Vice Minister, Prasha. She expressed very well what are the benefits of a solidarity-based mechanism. The main barriers right now in terms of a solidarity mechanism for procurement in medicines has to do with estimates. That's a big barrier that even though we've worked on it, to organize the demand is very important for the countries as well as for the producers, because according to the organized demand, then the production of quality products, which cannot be produced from one day to the next, it requires an organization in the demand for the countries. Another barrier that we usually do not talk about is the standardization of the protocols. The standardized clinical protocols requires the protocolization and standardization of protocols and products. And this is something that would seem in programs that are priority-based, like tuberculosis, HIV, and illnesses. They seem to be simpler, but in other products and illnesses where the procurement, the pooled resources like for cancer and expensive illnesses, high-cost illnesses, those protocols are yet to be standardized so that we can organize and consolidate that demand. On the other hand, there's also the barrier of the financial one. The financing one, even though the strategic fund has increased, it has not increased as much as the rotatory one. So the capital fund allows it, but still in the area of financing, our countries are in trouble. There are difficulties to create a procurement without having the financial resources readily available. This would require that the strategic fund think a little bit more about a bigger capitalization of the fund. I would say those are the barriers, the main barriers, insofar as benefits or situations that we can explore a little more in depth. I would think that there's an important area, which is to look at the fund, which is a modality of cooperation and organization, as a tool and a strategy of organization of the market so that we can increase the production and to increase the increase of production of medicines that have a high cost and for pathologies that we have in our regions and might not be in other places. And finally, I would say that in the area of the fund, in that area of chaining together the market, let's think of innovation and look at the strategic fund as a very important mechanism to bring forth innovation. The experience we had of a region that did not have its own market for self-sufficiency in this pandemic was very important. So I would take it up to that moment. Thank you. Thank you, Socorro. I think we established clearly some of the barriers and important opportunities that we can look at through the strategic fund. We are going now to Julio Garay, who is the chief of the National Tuberculosis Program in the Ministry of Health in El Salvador. Thank you. I think that the main barrier is that the strategic fund gives technical assistance to a whole region. And countries do not always have the same weight or burden of illnesses, and therefore in the procurement of one or other products. So one of the barriers has been for us the medicines for pharmacoresistant types of medicine. We have a couple of cases like that that does not allow us to buy easily for this because we have to come together with other countries to buy them. Or sometimes a provider has a leftover of a big order, and he sells it to us because it's not an important one. So the priorities of countries change relating to demand itself, but also the financial one for countries is important, because we need to remember that the priorities are different and they're not always on par with the priorities, the financial, the treasury offices. So sometimes we get the pro forma bills or the orders that we make, and we have a delay in the deposit of the funds, so that then we cannot acquire them on time. So as far as technical assistance, we haven't had many barriers. We have been very agile in the orders that we make through the OPS. And I believe that among the good characteristics of the strategic fund is the communication, the fluid communication, and the almost immediate attention to resolve a problem, an ongoing problem, when there is a need or there has been an order made. This takes us to think that not only does the strategic fund have that advantage price-wise and that mechanism, the agile transferring mechanisms and the quality of products with recognized providers, but also the good communication and agility depends a lot on the countries themselves, not necessarily in the team of strategic fund. So thank you. Thank you, Julio. Analia, you have the mic.
Especially to Javier, a good friend, for the invitation and to the opportunity to discuss this with you. I always like to say that if you're going to decide to procure through the strategic fund, or anyway, the revolving fund or pool procurement, it has to be an added value to what you can achieve at the local level. And I think it can be summarized in very simple terms in three bullets. Either you get quality, you get availability, or you get better price, or a combination of the three. We have seen our countries struggle with prices, and this is the first thing that comes to mind when you look at the opportunities and some of the challenges in procurement that the strategic fund can let you achieve. From the early 2000s to today, the price of treatment and the cost of treatment for a first line of antiretroviral therapy had went down to not only an achievable and affordable price, but to the cost that I can ensure that everybody could access to treatment. And that's thanks to pool procurement. It went out several fold from the beginning of the HIV pandemic, thanks to the negotiation. But we also need to take a look at other issues that the strategic fund have helped address. For example, access to medicines for neglected diseases. What we see today, that the only way to ensure the sustainability of manufacturing for certain disease, and that the demand is that demand remains stable and predictable. It's a pool mechanism for incentivizing the manufacturers of medicines that would address Chagas disease, leishmaniasis, and other not expensive treatments, but necessary treatment that are losing their commercial value. But something that we really need to remember is that not all the medicines are the same, regardless of price. Sometimes the price might look very attractive, but really what you're buying is not of the quality that our people deserve. We deserve to have quality, safe, and effective medicine. So our pool procurement mechanisms that can go out at the international level, coupled with technical cooperation mechanism and a quality assurance ensures guarantees that when you access those medicines are at the right price, that will be arriving at your country that where they might not be available otherwise, and are of the quality that you deserve. Having said that, every medicine and every health technology deserves pool procurement? As Prashad says, probably not. And we have to be strategic on the added value that the strategic fund can bring to the table. And as such, we need to identify our regional and country's key challenges. And when we come together to go through pool procurement and address some of these challenges, we have to choose our battles. So either to come together for price negotiation, to try to break the monopolistic pricing that some companies are putting on a very desirable medicine that happened at one point, for example, like a few years ago when we did the country negotiation for Hep C medicines, or a new antiretroviral that, gives you new opportunities for treatment and prevention, and that deserves countries to coming together. But then other challenges that we have might not be easy to address through the strategic fund in this political context. And I will finish by saying what Prashad started saying, that the political decision to run behind a pool procurement mechanism is the first and foremost element that actually either makes the pool procurement mechanism succeed or fail. If that political commitment is gone, you can bring the best to the table, but no political but this, the strategic fund and the revolving fund have succeeded after so many years because we have the member state behind them, and we have the decision to come together with solidarity to address the needs of our region. Thank you.
Thank you, Analia. Claudia, your remarks on this first question about, potential, barriers that the pool procurement could address, as well as untapped opportunities.
Thank you, Javier. First of all, just say thank you to invite me, and now I'm gonna change to Spanish, which is the language I feel more comfortable. La verdad es que
to tell you the truth, throughout those years of investigation of public policy, I've observed that the basic barrier to take advantage, its maximum possibility of the strategic fund, is the absence of information. Maybe not just information, but consciousness of the importance and the lack of transparency in the pharmaceutical market. The lack of transparency was recognized by the World Health Organization in its resolution 72.8 in the Assembly number 72 that recognized the faults in the access to public information, particularly insofar as price, costs, and development costs. To recognize this reality of non-transparency, we need to remind everybody once and time again, something like that, like the hide and seek that we call it so many in different ways in different countries. We need to decide if we have enough information to commit public public resources. And if we have enough information to make our best decision, we cannot do it if we're blinded. We cannot go by touch, by impulse, by instinct. No, we need the information. So what I would like to say, that's my message around this barrier, is that the strategic fund has a task here, because the pharmaceutical expense is extremely important in our health departments. A lot of money is going around, $1 in $5 maybe. But as far as the Americas is, we need to see that the pharmaceutical cost has gone up in about 12% in the last few years. And that acceleration, we see that the cost goes up 4 times faster than North America or Europe. So at the end of the game, not having enough information and not understanding the importance of the initiative of the strategic fund, it has to do with lack of information. When we don't have it, that generates a misuse of funds, monopolies, the low use of generics because we don't have enough understanding, and those inefficiencies, they have a direct impact in the population. The people could live at least 4 years more if we just worked on the efficiency of our health department. So I would like to go over that and really put stress on it, that we need like a Wikipedia of the prices in the Americas. That principle of collaboration and solidarity is tied to this transparency. This one for all and all for one that allows to motivate in a permanent way all the countries, so that we can then have an experience like the strategic fund and any other pool type of mechanism, so that we are more able to do this more efficiently. So this barrier of lack of information, I would like to say that we should have more public goods that provide this information. Initiatives like the strategic fund that add demand and redunds in the well-being of the population and helps the governments in their work. Thank you. After finishing with this general questions, we'll have some specific ones to our panelists. We're receiving some questions. The first question is for Socorro. Socorro, we wanted to know, how was the experience, principally in times of crisis in COVID, and the advantages that the strategic funds brought to the door, to the table, in order to bring resilience? Can you talk to us a little bit about this, of the strategic fund in this point? Yes, of course I can. Thank you, Javier. Thinking that the fund is a mechanism for cooperation that is 2 decades old, we see all the advantages that it has that have been talked about. It's a mechanism that allows pooled procurement and consolidates the demand. I would say that if we think in the situation that we experimented in the region and still are, specifically towards the south, where I am at present in the Americas, everything that we had organized insofar as demand of illnesses like tuberculosis, malaria, HIV, and others, and other things, not just medicines. We also have to control vectors. So all of these allowed us to keep those programs with the input that they needed in a time of crisis. That in another way might not have happened, would not have been as easy to do in a moment when the countries are in crisis and everything is facing in the same direction like the pandemic. So the strategic fund allowed those inputs that we needed at the time could be maintained and kept coming in, and avoid one of the most important aspects that we see in what refers to health is when you run out of inventory, when you interrupt the chain in the treatment of an illness. That is considered a very deep problem. So how the strategic fund was able to introduce the procurement the things of the fund was not used to dealing with the pool procurement in a market that has been managed between producers and the countries, like the intubation ones. So talking about intubation kits, this is a market where the strategic fund has not been before. So very quickly, with the strategic fund, we were able to create a cooperation so that those kits that were on high demand, that no national producer could generate, could fulfill. So with this mechanism, we were able to acquire them. So another aspect that's important that we also saw, the pool procurement has the contracting processes. In the moments of a pandemic, when you have to make decisions quickly and you have to procure things quickly, the risk that a country has to buy a product is a risk that goes down once you do it through a process, a mechanism that is consolidated, that has quality controls, and can be done quickly so that it can bring that market, regional and extra-regional, in order to supply such a delicate moment as is the pandemic. But thinking that the pandemic is did not just had an effect on the COVID part, but also had an effect and an impact in other programs that had discontinuity, that were blocked. So people who suddenly do not have access to medication can really miss out, and their health is going to suffer. Thank you very much. This is a very important. We need to point out how the fund was able to flexibilize itself to become more agile and incorporate products that it did not have a lot of experience with. So the risk is brought down. Julio, we would like to know a little bit about the cooperation, the technical assistance, which is one of the benefits that we haven't talked about a lot. With the pooled procurement, it's not just to give, to hand over the product. What is the whole process? How does the fund accompany the process? How can they benefit better? Is there an added value, significant added value? Thank you.
Dialogar y meternos en este campo, que es muy importante para aquellas políticas sanitarias y especialmente para aquellos problemas
for our public health problems that we need to report them as a region. Technical assistance.
I would like to first say that through the strategic region, there's always opportunities, not just opportunities from a quality point of view or a price point of view, but it also allows us for it to be a catalyst for cooperation, international cooperation, because especially when we have small countries like my country, the priorities are more of a sub-region. Here, we're so close to each other that whatever happens in El Salvador happens in Guatemala, quickly happens as well in Honduras, and that cooperation among countries allows us to have regional cooperation. So I believe that to be able to guarantee that the governments or countries' policies and the priorities are also around health, and that those health priorities also have relevance as well as importance, that's where PAHO plays a very important role through the strategic fund. Not just by aiding and assistance with trends, but also helping in the different ministries as well as the health issues to the level to which they merit so that they can be addressed and solved. And I think that we saw this during the pandemic. And it was when one of the ways in which we're able to put to test the strategic fund, you know, that it allowed us to continue the flow of supplies and medicines like tuberculosis, for example, that, you know, if it's not treated, the death rate is rather high. I think it also allowed, and we saw, you know, uh, shipping costs change, prices went up, but we had availability. So in that regards, I think that the technical assistance has also been very important in this regard. And the strategic fund and the way that it has been able to prioritize and work hand in hand with the ministries of health as well to deal with these health care issues has been pivotal. Thank you very much, Julio. And Alia, let me ask you a question from the audience.
Restricted to procure locally or regionally by their own regulations. How can we ensure that these countries can also have access to full procurement through PAHO? So if you can talk a bit about, you know, the number of countries and whether there is, you know, anything countries can do in regards to these restrictions in their own legislation.
Yeah, thank you. And I have to say that in general, I would say that most of our countries are extremely open to buying through the strategic fund to the procurement. There are very few countries that do not participate in the mechanism. Starting to procure through the revolving funds, it's a matter of signing an agreement to join. All our countries in the region that desire to do so can do it for public run programs, and that includes whether is the Ministry of Health or the Social Security mechanism. There's some countries that have local legislation that makes it a little bit more difficult to join, but it's a matter of, as we said before, of political will. PAHO will work with those countries that desire to access their funds in a way to accommodate the needs of that particular country, you know, maybe for a subset of products. We've seen countries that buy a large number of products through the strategic fund, while other ones buy very specific priority ones. So I don't think, in general, the countries that are in the past sometimes have argued that the problem was their own legislation. Generally, it's a matter more of a political will to embark on the process, yes, sometimes to review some of the rules and regulation. In terms of regulatory, when we talk about regulation of the quality assurance that a national regulatory authority does, that's one of the main advantages of the fund, as you well know, because our countries have the advantage of receiving the technical cooperation on our behalf, and it was particularly necessary during the pandemic. One of the main challenges was getting the goods, but what actually was even worse is ensure that the goods of quality, in terms, for example, of PPE, the number of falsifiers of standard products in the market that were available was staggering. We went through, my team does the quality assurance process, and we actually have to reject many products in the market because the certifications were actually falsified. So in a crazy time like this, the effort on the quality assurance of those processes. So we work with the national regulatory authorities in each country to try to help them understand what we do. Then we help them adapt the regulation, especially that they need during emergencies, to ensure that none of those regulations will prevent them from accessing products during a pandemic and a public health emergency. I'm happy to report most of our countries have the right legislation. The vast majority of the countries have used the revolving funds during the pandemic to access product without any regulatory delay. And it has even been enhanced our cooperation because it was an opportunity for us to share a group of experts and working together in a COVID-19 regulatory network that actually gets together every 2 weeks on focal points to talk what are the key issues and problems on regulation for COVID-19 products. And we have seen an amazing amount of information sharing, transparency, and cooperation amongst our member states.
Great. Thank you, Analia. And final question to Claudia before we turn to Chris for closing remarks. So Claudia, we heard a lot about the importance of selecting the right products, and we also heard about the importance of maybe expanding the scope of the strategic fund. What products do you think the fund should prioritize going forward? In a couple of minutes, please.
Tal vez lo ideal sería.
Perhaps, ideally, and this would definitely strengthen the strategic fund to be able to better respond to the country's needs, is to establish certain criteria that will allow it to anticipate the needs of those purchases, of those pooled purchases, and to improve the efficiencies. And I would mention at least 4 criteria. Some of them have already been mentioned by some of the panelists. But I think that number 1, to always guarantee that there is good monitoring of how the essential medical list is being updated at the WHO level. For example, the monoclonals, it's the type of medicine that has had the most number of inclusions to the list of essential medicines. And this then becomes a pressure on public expenses and the region's countries. Number 2, that the fund has done this already for hypertension medicine, is to do a monitoring of the intensity of pharmaceutical innovations. Hypertension is one of the ones that has the most amount of innovation. The second one is diabetes. And this has a direct impact on the number of prescriptions that are generated. Also, in the case of insulin, in a very short time frame with analogous insulin, the cost per capita, let's say in Chile, went up to $204. Colombia, $700. In comparison, for example, for Mexico, which is only $60. These changes in the intensity of use consumption need to reflect a little bit how the monitoring of innovations, in this case, in terms of insulin, is necessary to monitor those innovations, should be another of those criteria. The third one, I think, was mentioned already. I think Socorro mentioned it, and is the problems with availability of supplies. We're seeing them in injectables, low-cost cancer treatments, and some of these problems are not just lack of raw materials at the origin, but also lack of offerers. The cost is too little, so we would have to generate a large enough pool to be able to make production available and availability. And the last one is monitoring of the offer and competition monitoring. in our markets, especially, let's say, when we talk about the presence of generics, let's say biotechnological pharma, we've seen in the European market, and the speed of insertion of these generics into Latin America is too slow. There might be a lot of barriers, like regulatory barriers for the availability of the funds, perhaps understanding that those barriers cannot be incentivized. We have to do something about it. Maybe we can work towards improving the availability of the generics, but also to increase the number of competitors that make these available so that we can solve that lack of elasticity. But in other markets, we see where there's 4 or 5 offers, while in our region, maybe 1 or 2. So those 4, monitoring of the essential medicine list, 2, monitoring of the innovations in chronic diseases like hypertension and diabetes, 3rd, monitoring the problems with availability of supply more than just raw supplies, and lastly, monopoly and the availability of generics. Thank you very much, Claudia.
Give the floor to Christopher Lin. He's the unit chief of the PAHO Strategic Fund, and he's been patiently, listening to all these comments on his work. So, Chris, please, over to you.
Thanks, Javier, and I'll say thank you everyone for the excellent presentation. It's been really insightful and enriching discussion, right? And I think we've heard a wide-ranging and a cross-cutting perspective from various speakers and panelists. And they are all converging pretty much into the same theme here, right? Which is, now, why do we need a continuous access of essential medicines and supply? And the very critical need to mitigate supply chain disruptions, to improve on the affordability of medicines and health technologies, so that we can actually support the universal health in the region of Americas. We have heard, very, very consistent theme, right? Especially in terms of the importance of solidarity being the underpinning pillar for the success of strategic fund and pool procurement per se. And it was really highlighted by Dr. Jervis. And I would say almost every other panelist, right, that has spoken, and I absolutely believe this is very true, the underlying pillar here. Dr. Alessandro has also given us a very good view in terms of multilateral mechanism of strategic fund and how it has contributed to the journey of Bolivia towards a single healthcare system and working towards the primary healthcare 30-30 target. I must say that I really enjoyed Prashant's perspective of how we balance between supply and demand landscape, the balance of powers, and I would say the true adjacent services, right, that he mentioned about are indeed sweet spots for the strategic fund, which is pretty much inherent to us, right? Like, for example, activities like the demand shaping activities, the building of resilience in supply chain capabilities that we work with member states. As for Dr. Socorro, and I would say it was also mentioned by Dr. Julio and Cordia, in terms of the possibility of standardizing treatment protocols. I think that is important, and we have seen this clearly demonstrated in the HEARTS initiative for the Americas, and how that has actually invigorated, right, the entire program of introduction of generics, fixed dose combinations into the region here for anti-hypertension. And of course, Analia also did mention about the importance to pick the battle to fight. All right, making sure that we don't have a so-called a shotgun approach, right, to every single medicines, but really to pick on those medicines which is adding value from an access standpoint, availability, and of course price and quality that makes sense to specific countries in mind. Now, 2020 has not only marked the 20th anniversary of the Strategic Fund, but it has also consolidated our 20 years of operations and 20 years of concrete results, delivering upon our mission, which makes it an exceptional year due to COVID-19 pandemic. And we have also witnessed unprecedented multi-sectorial response for the region, and they have demonstrated clearly this part that we can actually go over this hurdle. 2020 has also exposed the weaknesses and the dependencies of global health supply chains, which has largely concentrated in certain parts of the world. And that has actually triggered initiations of forums like the World Local Production Forum, that's primed by WHO, together with multi-sectorial group of technological and industrial leaders. We have also seen the absolute need for resilient and robust healthcare systems that needs to withstand shocks. And this has been clearly demonstrated by the fact that we need to balance this important but yet fragile balance between efficiency and resilience. For me, this is not a choice. We need to do both, right? So that we can move beyond recovery towards sustainable and equitable health systems. Now, today's discussion is really the first of many to come that will allow us to continuously learn, reflect, and improve upon our 20 years of experiences so that we can better serve member states in the region. And our team has been diligently taking notes from this session itself, especially on the untapped opportunities, so that we can incorporate them into our strategic funds work plan going forward. Now, while I say strategic fund has stood up to the challenge and demonstrated how together with member states and partners that we can overcome adversities with grit. We will continue to use this spirit and adapt, like Socorro has mentioned, adapt innovatively, right? So that we can better serve member states in the next 20 years to come. Now, I would like to just remind viewers that the Strategic Fund website has got many more information, especially around our 2020 annual report, and also includes very candid verbatim experience sharing from member states, as well as our past year's reports and technical documents. So please visit that after this. And last but not least, I would like to extend my most sincere gratitude to all the speakers and panelists for being so generous with their feedback and sharing of experiences that give us so much to ponder upon. And I also like to thank our co-host CGD for being such a great partner, and we look forward for more collaboration. So back to you, Javier.
Well, thank you very much, Chris. So thank you all. Thank you to the speakers, the panelists, and our viewers. It's been a pleasure to be with you today to discuss this important topic. Have a good day, and we'll see you soon.